Hello, and welcome to this year's Community Needs Assessment public meeting. Thank you all for coming. Can everybody hear me okay? Okay, awesome. So to begin the meeting, I'd like to begin with some introductions. My name's Erin Kautz, and this is Cindy Kennedy. We are both grants administrators working on both the Home Investment Partnership Program, known as HOME, and the Community Development Block Grants, also known as CDBG. We have some other grant staff here today to help us. And could the other grant staff stand up or raise your hands so people know who you are? All right. If you have any questions about our programs or this process, please feel free to ask any of us. I'd also like to let people know that MCAT is here recording this public meeting, so please try and speak up when talking to the group. And just a little bit of logistical information, please help yourself to food and drinks on that table over there. We've got lots, so don't hesitate to grab some. And also, if you need to use the restroom, it's right outside this door on the left-hand side. So we have a lot to cover in the next hour and a half, so I'm now going to hand this over to Cindy.
Thank you. Thank you. I'm Cindy Kennedy, and do you want to hit this? Sorry, I should have done that. So our agenda today is we're going to talk about the results from the online survey, and hopefully all of you participated in that. We had an incredible response rate, and I'll talk about that in a minute. And then we're going to do some group work. We're going to divide into groups based on your interests or areas that you hope to maybe get some funding. Housing, economic development, public improvement, facilities, and public services. And then we'll conclude with and wrap up. We're hoping to have a little bit of time at the end for questions, so we're kind of on a tight schedule, and we do have to get out of here by 5:45, so we'll be rushing to get out. Next slide, please. Okay, so tomorrow, just as a reminder before we dive into the agenda, tomorrow is the CDBG and Home application workshop from 9 to 11 in our office at Grants and Community Programs, 223 West Alder, and we would love to see you there if you're interested in learning more about how you can apply for those funding opportunities. All right. And we just wanted to establish some ground rules before we dig in because, like I said, we're on a tight schedule. Please, if you haven't already, silence your phones and any other devices. And before you speak, if you'd introduce yourself, we'd really appreciate that. We want to respect everyone's ideas. No idea is a bad idea. We want to allow everyone to speak, so we try to avoid interruptions, but we also want to keep our comments brief and constructive and kind. And we'll do our best to keep to the agenda. So moving along. So the intent and purpose of this meeting is the Community Needs Assessment helps us identify and define our needs, strengths, and assets. It is the first step in determining how to effectively utilize home and CDBG resources. The assessment is done as part of the consolidated planning and annual action plan processes. Participation in the planning process ensures that community development projects reflect what the community wants and needs. Feedback provided will become part of the public record. Again, we have MCAT here and we're taking notes. The work that you're going to do here today is very important, so we really value your time and your energy that you're going to put into helping us prioritize the community needs. All right, so now a little bit about the online assessment. So we put together a survey and distributed it to just about everybody and their brother and tried to get as much of a response as we could. We ended up sending out 357 emails. We got 197 responses. It's a 55% response rate, which is about double what is expected with an online survey. So way to go, guys. Very impressive, and we're very pleased. I want to say the survey was not scientific. We did our analysis in the office, and honestly, we could analyze the data in a multiple different ways. So hopefully the way we analyzed it will make sense to everybody. Your turn? Okay, I'll turn it over to Erin. Thank you.
We're trying to prevent people from getting too bored listening to one of us talk. So this is going to be some of the results of our survey. As you can see on this slide, we asked people what organization that they were affiliated with, if anything, And of the 197 people who completed the survey, the largest group were part of nonprofit organizations. Next was individuals who are not part of an agency, and then people who work in city or county government. One thing I would like to note as well, we realize that these are not going to be easily seen, especially if you're in the back. So we are going to be providing handouts of this later when we're doing our small group, so if people want to look at it more in depth, that's a possibility. And we're also going to be putting this up on our website tomorrow. So if you want to come back and look at this later, you're always welcome to. So I apologize because I know that this is not always that easy to see. Nancy's rubbing her eyes back there. We could have gotten you some binoculars. All right. So I'm going to talk a little bit about what housing questions we asked. On this graph, you can see that the blue bars represent the high and medium need, and the green bars represent low and no need. Most of the graphs that you'll see are in the same format to give you an idea. So the largest percentage of respondents, 75%, thought housing for families with low and moderate incomes and housing for mentally ill and severely mentally ill individuals with low and moderate incomes were high need priorities in Missoula. Overall, responses for this question leaned heavily toward high need, as you can see. And respondents generally thought housing was a high need priority for all these listed populations. We also gave people the opportunity to put some qualitative data in. So these are some of the responses that people have, and I'm not going to read through all of them because, like I said, you will get the option of reading through those later. But we also have a full list if anybody wants to see the full amount of comments that we got about these sorts of things. Next, we asked people about specific types of housing that was needed in Missoula. And the majority of respondents, 77%, thought rental assistance for renters with low and moderate incomes was a high need. 66% thought down payment assistance for individuals and families with low and moderate incomes was a high need. So, and then half or more thought fair housing counseling and construction of rental housing for individuals and families with low and moderate incomes were high need priorities. So this gives us a pretty good idea of what people are looking for who answered the survey. Once again, there's some qualitative responses that we got. One thing to note is when you see n equals 2, you'll see also n equals 3 later on. That means that 2 or more people, or in this case n equals 2 people had similar sorts of responses to that. So it gives you an idea of those sorts of things that people were looking at. Next, we asked about housing repairs or improvements needed in Missoula. And according to the survey respondents, improving accessibility for people with disabilities is the highest need in the home repairs and improvements category. Close to half of all respondents thought that rehabilitating existing properties, repairing and improving rental properties, and improving rental homes were high needs. So this also gives us an idea about that. And then we also have the people were able to answer other needs, and this is what they said. And a lot of it involved rental properties being up to code. And here's some more housing repairs needed, energy efficiency, weatherization, etc. We also asked people, since this was geared towards both the county and the city, we asked where in the county would people like to see, what areas in the county would people like to see improvements made? Where is that need the most? And overwhelmingly, the East Missoula community was high at almost 75% as that there is a need. And then next after that was the Bonner Milltown community. And so that tells us who answered the survey and what they felt the need was. People mentioned other Missoula County areas that needed work and that had a high need, such as Target Range, DeSmet area, and Sealy Lake, specifically improving houses on farmland. Then we asked within the city what neighborhoods were housing needed for these specific populations, new construction or repairs and improvements. And the north side, west side was just over 75% there. Next was Franklin to the Fort neighborhood. Or no, next was Heart of Missoula, followed by the Franklin to the Fort neighborhood. So that gives us an idea as well of where people would like us to see prioritize some funding. And people also answered some other Missoula City areas that specifically that they felt like needed work. And there's another slide on that. So yeah, there's a lot of places that people felt like needed work. So next Cindy's going to talk about public facility needs.
All right. Okay, so by and far, the majority of respondents selected shelters as high needs, and while the high need responses for other categories were relatively low, with the exception of youth center sub-question. Both shelter for families experiencing homelessness and shelters for youth experiencing homelessness were selected as high needs by 76% of respondents. 56 respondents selected shelter for survivors of domestic violence as a high need, and 43% selected a youth center as a high need. So family and youth homelessness and homelessness as a result of domestic violence were definitely big concerns. And again, we have qualitative responses. N equals 5, so 5 people talked about shelter housing for people experiencing homelessness. And that gets broken down a little bit more, and like Erin said, we will share all of that data with you. The list of comments is extremely long and very, very interesting and valuable, so we'd love to spend time going through all of it, but I think that we'll not do that today because we don't have the time. So this one is all of the public service needs. This slide is very, very busy. So we broke it down into 2 slides. So this slide explains 63% services, can't read that, for abused and neglected children. So that's the highest need on this slide. And the next slide is half of the big slide that I showed earlier. Besides supportive services for people experiencing homelessness or at risk and substance abuse services, the most selected high need was more than half of the respondents selected basic needs services and services to address food insecurity. All right. And transportation was a big issue that came up in a lot of different questions. Improving routes and hours, expanding hours, came up a lot. 4 people talked about that in terms of services. Mental health services was also another popular topic that came up a lot, and financial and rental counseling and education. Again, more transportation. 10 people here talked about expanding the bus public transportation routes. There's a lot of overlap in the qualitative data. And so sometimes folks would say the same thing over and over again, and we tried really hard to collapse all of that. And then supportive services for people experiencing homelessness and energy conservation programs were big topics. And in economic development, almost 75% of those surveyed think job training and opportunities for at-risk populations is a high need. 63% think job creation is a high need, and 68% think improved internet connectivity infrastructure is a high need. And improved internet connectivity was, in terms of the comments, was mentioned the most of all of the economic needs. All right. So, yeah, we're moving along. Thank you. Erin's going to talk about our next project.
So that is our survey responses. Does anybody have any questions at this point about the survey or any of the responses we got? Okay. Patty.
Well, it's just possible that maybe some of that information depends on who's answering it and the groups that have answered. And
Yeah.
maybe some people answered more than once.
People couldn't answer more than once.
Oh, they
Yeah.
couldn't.
Well, unless they went to a different computer. It was,
So, I would just urge us not to have the work of the folks showing up today be undermined by the survey. I mean, I think it's always interesting and fascinating, but the folks that get the work done and are on the ground that show up,
yep. Yeah, we agree. So, yeah, this is part of the feedback, and then today is obviously also a very vital part of the feedback to that as well. So, any other questions? Okay. So now we're going to talk a little bit about the next steps. As you came in, you may have received a project sheet if your agency or organization is interested in applying for funds in the next 2 years. So if you could take a moment to fill that out, that would be great. We're going to be trying to collect those at the end of our small group section. So. And now at this point, we're going to do things a little differently than they've done in past years. We are going to separate into small groups based upon your interest. And I know some people might have more than one interest, but if you could just focus on your highest priority. And those are going to be housing, economic development, public improvements, facilities, and public services. I'll be facilitating the housing. Nancy Hart, who's standing right there, is going to facilitate economic development. Cindy Kennedy is going to facilitate public services. And then Jean Hart, who's right there, is going to facilitate the public facilities. So, and we'll have signs at each table, and then we'll move forward from there. But basically, what we're going to do is we're going to give everybody 20 minutes. And the first 10 minutes is going to be, we're going to ask people to brainstorm, to talk about what they see as priorities, what they see as needs, what they would like to see happen in Missoula. And it could be from information collected on the survey, or it could be information that you brought here, that you already had in mind. And then the second 10 minutes are going to be prioritizing that. And we're going to try, based on what you've written down on your sheet, we're going to prioritize at least the top, or at most the top 5. And then after that, we're going to ask each group to do a short report to the rest of the group so that everybody can kind of see what the other groups talked about. So that's that. So Jean, do you want to be back there? And then Nancy, do you want to be back? You want to be up? You want to be up here? So economic development up here, public facilities back here, public services will be back there, and then I'll do housing right up here. So we'll break for 10 minutes to get into small groups.
And we want to kind of review these tables and charts, and again, it's two graphs. It's 2 graphs that are divided. So they're basically asking the same question, and we asked people to describe public services that they feel are needed in the community. So services for abused and neglected children was really high, and then services to support supportive services for people experiencing homelessness or at risk for homelessness was really high.
So I have a question.
Sure.
So with financial education for home ownership, that name category is that taken directly from the survey? Because, and I don't see though financial education or financial literacy and rental education and counseling, which
I think
did I have to add that in, because this is interesting to me that financial education, not that, I mean, we do that, but it tends to serve a higher income, whereas our financial literacy programs in general, not for home ownership, serve more the population that would be appropriate for CDBG funding. So that, I feel like this is misleading. And if I was filling out this survey and I didn't know the type of work that we do, I would not rank that high, because it says for home ownership. People that are ready for home ownership typically are not in the core human services. They're not accessing core human services. So I find that a little bit misleading and really not what I would think we're trying to go for. So, and if we had one that was like rental education and counseling or financial literacy, then I would say, okay, well, there's also financial education for home ownership. Then that's 2 separate things to a certain extent, serving related but different populations, So I thought, I know I filled the survey out. Maybe I had to add rental education and financial literacy.
And maybe this, there's this comment here, and I don't know if it's addressing what you are saying, but there's a significant need for financial and rental counseling and education. Montana ranks last
I
in
wrote
financial
that.
IQ. Okay.
Yeah.
I kind of wondered. I'm like, this is
Either that
really
or someone out there
articulate.
thinks
I'm
just
like,
like
That
you.
sounds like somebody I know.
Okay,
So, yeah,
so-
that's just, it's a little misleading. I would not
Yeah.
rank it as high just because it's got the term home ownership in
Uh-huh.
the
Versus
category.
rental.
Yeah.
Yeah.
And do we have rental in here?
They don't. I mean, I could say without hesitation that if that did not have the term homeownership in it, it would have ranked significantly higher, even though it's relatively high already. Because I would have called it financial/rental education services.
Yeah, and we'll definitely make that change in the survey. I mean, we really appreciate that feedback because we're already making changes to the survey for next year. So
Okay,
that's
okay.
really good. So
See, I'm
definitely.
talking loud for that. So.
Definitely, like what Patty said, she was spot on. This is not set in stone. It's people's opinion, it's self-selection. It's not a scientific process where it's a random survey, and so, a random sample. And so, people choose to fill out the survey based on their interests. And so it is what it is, and we can interpret it how we, feel fit. But I think what we want to also do is recognize, are some of these needs indeed what we think are important in this community? Substance abuse services is another high-ranking one. And then what else? And I think we want to come up with 5 priorities that we feel are the greatest needs in the community. We base it on this. We can, review and the qualitative is a lot to get through. But transportation was a big one. Mental health was a big one. Financial, you've got your comments there. Childcare, transportation keeps coming up, and services for people experiencing homelessness was also another big one that came up. Granted, a lot of folks that put down the checkbox on the quantitative on the graph also may have added their comments, so it could be duplicative. So that's something to keep in mind as well. So what do you feel? Let's just go around the table and talk about what we feel are priorities, and then we need to kind of reach some consensus of at least prioritizing 5 things. It's hard to pick just 5.
What'd you say?
Hard to pick just 5.
Yeah, totally.
Can I
5 or
just
less.
ask, so both of you are city staff.
Uh-huh.
So are you
Participating?
Right? Are you participating?
Not necessarily.
Okay, and so you're with Garden City Harvest,
Missoula Aging Services.
Aging Services, and Homeward. He's an affordable housing developer and housing counseling agency. So I only have.
I coordinate the justice system response to domestic violence. So just so you know,
Yes.
my lens is that direction.
Okay.
Domestic and sexual violence.
And I tend
child
to
abuse.
I work with the At-Risk Housing Coalition and Continuum of Care grants in addition to the CDBG work that I do. So that's another lens that I come to the
So
table.
we have 5 people here, and we're trying to pick 5
Yeah, we
with
each
all
pick our
different, causes, related but different causes, and we're trying to come up with 5 priorities. I mean, I could say where your outcome, and I mean, these are all absolutely key. I mean, food insecurity, senior services, housing and financial stability, food stability, homelessness, domestic violence. I mean, I would say that's frankly, those are like the core. I mean, they can be argued, but nonetheless, I think we have representation from what some of the highest needs in the community
How
are.
do you do that?
I agree. Well, I think we all can agree that food insecurity, Missoula Aging Services is doing Meals on Wheels, among many other things. Garden City Harvest is addressing food insecurity. The food bank is also a CDBG recipient. They're addressing food insecurity.
you guys are addressing the need for financial education.
I mean, what we're doing is working across the community with partnering with a lot of nonprofit organizations, and in addition to providing our own services, trying to increase the financial literacy skills of folks that are accessing social services, trying to prevent people from needing social services by being able to make smart, educated decisions around household finances, but also helping break cycles of poverty for folks that have made those mistakes, fallen into those pitfalls. We're developing a rental education and counseling program, which we've heard from last year's community needs assessment was a significant need that nobody is doing here. And so that's a need that falls within the continuum of services we provide, and it just makes sense for it to fall into Homeworth's bailiwick, which I'd love to try to work that forward in. And then we do housing counseling, so pre-purchase, but also just housing counseling services and homeownership.
And and bank and foreclosure.
And foreclosure prevention services. There you go. Testimonial.
Good.
So it's housing stability, financial stability, and prevention of homelessness. Really, I mean, it's all interrelated.
Right. Okay. So, how would we rank if we were going to rank those 5? Where would we start? What would be the number 1 out of all 5 of those? Did we come up with 5?
Should I write this down up here? Is that what that's for? Is that for something
Yeah.
Should we agree to it first before you write?
Yeah,
it, or-
let's come up with our ranking, and then we'll make it nice and party.
Okay.
I mean,
So
food insecurity to me, that's a given. That seems like, they're going to be dealing with housing, right? So somebody else is dealing with housing security, so we're not dealing with that. Because housing and food are, I mean, homeless services is up there in my opinion.
Yeah,
Homeless
I agree.
services, food security. And those are the most basic of basic.
And really, if we're talking about homelessness, food insecurity, and domestic violence, that's 3 items. And housing, counseling, 4 items. Is that right? Do we need to come up with a 5th? We don't have to.
Oh, okay.
It's 5 or less.
So say again, we've got food security, homelessness, domestic violence, rental / financial literacy counseling. I mean, I think that, addressing the needs of senior citizens with an aging population is pretty darn key.
Yeah.
I think in this community, substance abuse services are a huge issue.
Well, and something that I don't really know that we do, I'm sure we do in, like the forum, is doing work around preventing abuse and neglected children.
Yeah.
And that's a high priority here. Would we include that as a 5th? Do we feel like?
I don't think you can argue that.
Yeah. Well, just from my previous job, I know that it's a huge problem. And our service, our family services, child and family services department is way overextended.
I mean, we did a survey. I mean, we're an affordable housing developer, and so we have about 175 units here in Missoula. We did a resident survey asking, essentially trying to measure people's financial capability skills, the services that they need, and kind of understanding some other basic demographics and their experiences. And one of the things that we heard, rental education counseling, eviction prevention was key. And then we heard the need a lot from seniors. We had a lot of folks. It dominated, actually. It wasn't perfectly representative of our residents, but the need for access to health care. I mean, that was access to health care.
Oh, yeah.
That they just felt there was gaps and they were not getting basic health care services. And an incredible feeling of isolation. Even though they have affordable, sustainable, beautiful housing, there were still needs that were not being met. People had a sense of isolation, and now we're developing programs to help respond to that. How can we put that? We held a healthcare workshop with navigators on site at our Equinox building, or Solstice building, excuse me, to try, meet people where they were. And so what other types of, but that's what we heard from our residents, and that eviction prevention is part of rental counseling. Once people can get get access to housing, that they are able to do this and maintain and prevent homelessness. Those are the same folks that potentially have been formerly homeless or potentially could be if they have financial instability.
I guess that's how you see so many of these things seem sort of separate, but they're also very much interconnected. And something could happen to you and it could affect you, your housing or ability to get food, or
Domestic violence.
tough things happen and then or before or after that is,
Thank you.
is the case.
I think we actually might be posting.
I mean, 70% reported that they feel financially insecure. 70% said we feel that they felt financially insecure.
And this was of your senior residents or
Of all of our residents. It's just that we incentivized with a $10 gift card people that were available and willing, and that was a big incentive for them, were the ones that responded to the survey. We did in-person interviews. And so Maggie, who's a Vista, she's here, she's the one who actually did those interviews. So seniors tended to be, even though we would do it after work hours and on the weekends, the ones that were most available to respond.
Yeah, and we, excuse me, I think I'm losing my voice, or maybe I'm just getting back. We also serve adults with disabilities, and so there's a lot of overlap there.
Sure. Yeah, and with Meals on Wheels.
Right.
No, I'm losing my voice. Too much talking.
Going around.
Yeah, and that's a really good point, because I know that services for people with disabilities comes up a lot too. So that's just looking to see how much of this is, because there's a lot of, and that was one of the things that was by design with this survey. We did not want people to rank. We wanted them to be able to identify multiple areas as high need, and we could have done it the other way. We would have gotten, and when you're forced to rank something, myself as a survey taker, I get really frustrated.
Yeah.
So I'm like,
You gotta make this forced choice, like,
they're all important.
Yeah.
So that was by design. But when we just look at some of the stuff that are over 50%, employment services, youth services, services for people with disabilities, the services for abuse and neglected, child care, survivors for services for survivors, and health services. I mean, it's phenomenal how most of these, I would say,
how is basic needs services, which to me is across the board, everything is defined as basic needs, what does that mean?
Basic needs,
shelter.
Because they are actually, they're distinct,
right? Food, shelter,
they're distinct categories in addition to having basic needs, so that's,
So
and that
some
might
of
explain
these
why
could
it's
maybe
so
fall
low.
into
yeah,
that.
I would think most of them do, maybe not
Right.
recreation or transportation.
Well, and like I think Word and maybe the YWCA have grants where they're called basic
Okay.
need, and it's really depends on where folks have the needs. But yeah, that's a good point. We could X that one out, because it does get
That's a
captured.
catch-all kind
Which
of.
one
It is.
again?
The basic needs, it's, most of these are basic
Isn't
needs.
that a HUD term?
It's HUD, continuum care. Yeah.
Because that is, when you say basic needs, that's a judgment, right? I mean, it's not defined, so,
Yeah, I mean it's that hierarchy of needs: food, shelter, clothing.
and
But you're right, they get addressed everywhere. But yeah, so substance abuse services is big, homelessness, support services for homelessness, services to address food insecurity. So, yeah, and it's interesting that the basic needs is as high as it is, considering that it's captured in all of the other.
I think probably
But
the same people that answered one
Exactly.
answered the other.
Like if I
Right.
checked food
Yeah,
insecurity,
I would have said basic needs, me too.
That makes sense.
So what are our top 5?
So, bearing in mind, we have substance abuse is high, and we didn't talk about that. We came up with food insecurity, homelessness, domestic violence, rental and financial literacy, and abused, neglected children. Do we feel like we need to get?
We have to choose, we have to narrow it down to 5.
Well,
And then
it's,
if we do
it's
substance
5
abuse,
now,
yeah,
but if we add
five.
substance abuse, that's
And then
6.
just services, we just.
Oh, no, I've got 6. No.
No, that's 2. This is the same.
Oh, that
Yeah,
one's 1.
it is, sorry.
And I mean, I also, it's a little harder to articulate. It's also eviction prevention. So, you know, I just want
like
people to
related to
understand that
homelessness in
rental.
some ways.
I think literacy kind of captures
Okay.
a lot of what you do. Do you feel that way? Is that a good way to put it? Because it's more umbrella.
Eviction
Yeah.
prevention's pretty strong.
It's powerful. Eviction prevention is more powerful, and I mean, rental education can look like a lot of different things. It's rights and responsibilities. It's also, you know, helping people be successful renters. It's helping the financial counseling piece is being able to budget and be able to pay your rent, pay it on time, and then also the counseling to be able to become rent ready, find housing, fill out the application, you know, actually get into housing. So it's a very broad spectrum, and that's why it's hard to, sometimes we do stuff that's hard to explain in like a soundbite, you know? So it's kind of all encompassing, and I want it to be, I agree that eviction prevention and financial literacy are more powerful than just to say rental education.
Okay. Would we put that on one line?
Yeah,
Okay.
they are one and the same, really.
Bring some kids from school, huh?
So,
You guys donate a lot of, or you give, I don't know how that works, because my husband used to work at the food bank, so you give a lot of food to the food bank, right?
Yeah, we distribute a lot of the food that we grow. About a third of what we grow goes through the food bank and gets distributed to their patrons. And then we also give food to the Paparella Center. All of the youth homes, group homes, get food from the youth farm that we have, and maybe a dozen other or more service agencies get.
Plus it's healthy, because that's my husband was so frustrated because the affordable food is the stuff with high sodium and, you know, can pop with a can and whatever.
absolutely.
But the food bank, I know it's something that's really important to them to offer things that are as healthy as they can be, and so yeah, like it's.
Yeah.
I think it's on the forefront of their minds as well.
Oh, we should probably make our list. Everyone's got a list.
Yeah.
So of our top
listless.
5.
Well,
We're listless.
we're making our list very pretty.
Okay.
Just
making our
on a
list
side note,
Yeah.
when we're reporting, can you report your projects? Anyone
Yes.
else have projects? Eileen, do you have projects?
Is 20,000, is that the most, or is it 25?
It's 20.
Okay, thank you.
Yep. All right. So we'd be leaving off substance abuse if we just went with this 5. How do you guys feel about that? Do we need to? Substance abuse services was 64. Services for abuse and neglected children was 63. You know, my thinking about that is that if we get them while they're young, we're going to prevent substance abuse.
Yeah.
To me, that's provide that service when they're young. That's my take on it, but I don't know,
Yeah.
because they're both really important.
They're all
But that's kind of assuming that all children who are abused and neglected go on later to abuse substances, and I think there are a lot of people who go through different things in life that lead them down that road, and it's not necessarily because of abuse or neglect.
You're right, but
to play devil's advocate.
the ACEs study demonstrates, you know, that ACEs, what is it? Adverse childhood events or experiences. It demonstrates that continuum of, you know, because that abuse and neglect is traumatizing, and so the more events of those types of things that occur, the more likely they will have those.
Self-coping.
Yeah. So just thinking about it in terms of statistics and data, that's kind of that continuum. But you're absolutely right, it's not black and white at all. But that's, you know, I feel like, and I came from education, so I'm always thinking prevention. And the more we can do with kids when they're young to try to prevent those adverse events in their lives or experiences, I think, I don't know, that's where I'm coming from, but I could totally, my mind could be changed if we run out of time, so.
Probably anything you could that makes sense to me.
Okay, so in terms of priorities.
It's too hard to rank for me, so.
I know. Thanks, Jenny.
So we rank now in a specific order.
Yeah,
Because it all is so related.
it's all related.
I mean, I think homelessness is first, in my opinion.
Yeah, I mean, definitely the basic needs.
And I think
buy
food
into.
security is second.
Okay,
And we have homelessness issue for sure.
and a food insecurity.
Yeah.
Do you guys agree with that? Okay, and then what? We've got domestic violence, financial literacy and eviction prevention, and abused and neglected children.
It seems like maybe the housing piece would go next.
Okay.
Just because of how
Eviction prevention and
preventative it
financial literacy.
is. Yeah. And I like the breaking the cycle of poverty piece of that a lot.
Okay, we're doing better than it looks.
Yeah, we are. I think domestic violence is next.
Yeah, domestic violence.
If that impacts children and,
Yep.
I mean, families.
Yeah, I mean, they're kind of, I mean, it all meshes together, but domestic violence and abuse and neglected
So
children.
then those are what those are assigned.
So you ready to make the list? Hopefully you can read my handwriting.
Exactly.
Well,
All right.
is it
So at the very top, put community.
public services?
Public, sorry, my brain just stopped working. Public
Markers?
services, there's
right.
one right here.
It's not a pretty
If you
color,
don't
though.
like that one, there's blue over there.
Beautify.
Okay,
It's a really
Oh, beautify.
there you go.
Easter, it's Easter.
Can you read that?
I can't.
So I'm gonna go grab my coffee because I have a latte that's getting cold.
All right, so this is the housing group, and we threw out a lot of different nuances to need, but I think we were able to distill it down to the fact that we have a real need to reduce barriers, and we put that in under, you know, transitional housing for homeless, and then we had it tied back to repairing credit, financial history, those sorts of things. The barriers to accessing affordable housing were really important to address. And then the housing itself, there's a myriad of housing needs, but the key component being affordable rental housing, affordable housing preservation, new construction. There was discussion around making sure that we addressed stick-built manufactured homes. There were a couple of very specific projects, but TBRA, the attendant-based rental assistance, was important for getting into housing. We talked about zoning, inclusionary zoning, ADUs, things like that, as ways to generate affordable housing. And I think basically addressed every nuance of housing we could think of. Did I miss anything, guys? The secure crisis housing. Yeah, again, another subset of affordable housing that we need to make sure we address.
Actually, that should be under public facilities. The ED
We-
piece.
Sure, we can make sure they get cross-referenced.
Perfect.
Okay.
All right, Heather.
Go housing. Suckers.
All right. Public services, do you,
Yeah,
I
does
think-
anybody in your group have a project sheet that they wanted to share, or are we gonna do that at the very end?
well, we just kind of added it onto our list right here, and well, we can talk about it. I can talk about it. So we talked about that there has been some talk about wet housing, harm reduction housing, and Sweetgrass Commons through Homeward, possibly some Sealy Lake project and Homeward. But we're looking 5 years in the future potentially. And resident-owned communities through NeighborWorks Montana. Human Resource Council is gonna look at tenant-based rental assistance, TBRA, mobile home repair, owner-occupied rehab, and home buyer assistance. And then the Open Aid Alliance is also looking at a job training program, which isn't necessarily housing, but an important service.
Do you guys need to use this too, or does that?
We could go through
Put on green.
Yeah. I can use that one.
Okay, so for public services, can you guys hear me? Because this is,
You have to use this one. This is just for the
I know.
MCAT.
I don't want you to get feedback, so should I put this?
But it should go in all this.
Thank you.
Okay, so the folks in my group that have their projects, they're gonna talk about those. So we're just gonna talk about our priorities. We prioritized 5 public service areas that we feel like need to be addressed based on the results and based on the feedback with the group. So I'm sure you can't see this, but we prioritized 1 through 5. So number 1 is providing services to address homelessness. Number 2 is providing services to address food insecurity. 3 is financial literacy and eviction prevention. 4 is domestic violence services. And 6 is services to address abused and neglected children. Kelly,
Oh, that was 5.
did I say 5?
No, you said 6.
Sorry, 5.
We actually had 6, and we had to narrow it down to 5. So, would you guys like to talk about the projects that you were?
Do you want us up there?
Yeah, please. Sorry.
Hi, everybody. I'm Kelly Battaglia with Homeward. So we are on this list of public services as priority number 3, with financial literacy, foreclosure prevention, which isn't mentioned, and eviction prevention. We will be asking for $20,000 in the upcoming funding year to help support our program. We have historically been funded by CDBG in the past. We added an eviction prevention rental education program due to the community response that we heard through this process last year. And so I think that's what we'll be going for in the upcoming year.
All right.
Do you want these now?
Yes, we do.
Want them?
Yep, thank you very much.
Yep.
Eileen Sansom with Missoula Aging Services, and we, again, in the coming year, plan to address priority number 2, food insecurity, and that will be to the most vulnerable population that we serve, those homebound adults and adults with disabilities who qualify for our Meals on Wheels program. And we expect to ask for 20,000 or thereabouts.
Hello, I'm Maria from Garden City Harvest, and we've also been funded by CDBG in the past for our Orchard Gardens food security project that takes place at the Orchard Gardens neighborhood farm, which we created in 2010 in partnership with Homeward, and it's located at one of their housing developments on the west side of town. And basically this project aims to fight food insecurity here in Missoula. We have a lot of programs happening at the site, from renting community garden plots for a really affordable price, and teaching people how to grow their own food, kind of with the idea of if you give a man a fish or teach him how to fish. We distribute a good chunk of the produce we grow there to the Missoula Food Bank. And we've got a whole other slew of activities that are offered on a sliding scale, from summer camps to weekly vegetable shares. So we're going to ask for help for that again this year.
Can I ask you a quick question? Are you asking for help to build greenhouses so we have a baby go to year round?
No, good idea.
All right. Who's next? Jean, your group?
Yes. Is it needs and projects? It's, what would you like? Would you like needs separate from projects, needs first and then projects?
Whatever works.
Okay.
Whatever you're comfortable.
Well, we
We're
might-
all in project.
if people want to talk about their own project, please feel free to do that.
There you are. There's, look like your list is longer, and I don't know. They're all listed.
These are the needs, as represented by the projects proposed. And I'd like to hand it over to Andrea to discuss those projects.
You betcha, you bet. The first two, so two priority projects for Missoula County Public Works we're working on right now are addressing. Oh yeah, sorry, that's why we came up here.
Yeah, you kind of have to stand there. It's a little wonky.
I'll hold this like this.
So Amy Rose, I'm Assistant Director of Missoula County Public Works. The top two projects are two rural communities where we're trying to address wastewater solutions in areas with high septic density. The first one is for a resident-owned community, Buena Vista community. It's a small mobile home park. We're looking to connect them to city sewer. It is a shovel-ready project, and we only need about $400,000 approximately to get this off the ground, or in the ground, actually. The other project we're looking to the future is for the Bonner Milltown area. Again, just looking to address their wastewater issues. We probably will not be ready to go after funding until 2017, and at this point we do not have an estimate. We just know it's going to be over $1 million.
Great. Patty, you want to talk about yours?
Sure.
I think you have a few of them on this
I
list.
have a few. Patty Kent with the Mental Health Center. Public facilities is kind of the default category for things that don't qualify for housing, even though they look a lot like housing. The stay may be too short, the type, if there's any sort of treatment involved. And so if there's confusion as to why I'm not sitting with housing people, the projects that we have currently are related to mental health crises and addiction treatment. So youth are also excluded from the home program. So public facilities is it for us. We are in dire need as a community of an inpatient youth addiction treatment program, a permanent facility that works very closely with family schools and is in a location that makes sense. That last part is probably the hardest part. Based on what we spent for the Missoula Recovery Center for Adults, I'm guessing we're looking at a couple of $1 million for 16 beds of inpatient care. The second project would be youth crisis stabilization, which we have a number of adult crisis stabilization homes that are voluntary. And when someone is in an acute psychiatric crisis and they have nowhere to go, we provide a place that's safe with appropriate therapeutic care for someone experiencing a crisis, which is usually a suicidal ideation. And as most of us know in this room, we have a tremendous suicide problem, particularly with our youth. So that is something that's lacking and would be a good thing to have as a resource in our community. And finally, along that same lines, we have voluntary crisis stabilization, but we don't have secure crisis stabilization. The Mental Health Center embarked on adding what they call secure beds for people who are in an interim stage between being deemed a danger to themselves or others and pending their commitment hearing. And statutorily, that's called emergency detention. What happens in a lot of counties, and somewhat in Missoula County, is people are often sent to the state hospital at Warm Springs, which is extraordinarily expensive and disruptive. So having a supply of secure beds to serve people in their community where once stabilized, they have an option to go into voluntary treatment in lieu of their commitment hearing is a model that's worked extraordinarily well. So we are looking at, with the county currently, with some funds for adding secure crisis capability to the voluntary crisis homes that we have. Thank you.
Oh,
Sorry, game over.
That'd be it. Part of the, is there two microphones? Okay, well, we can put a sock on that.
It still works. I'll go sit down.
Wait, will you help me find it?
I see it.
Do you? Are you filming this?
Yeah, I'll just set it up.
Way to be memorable, Patty. Mic dropped.
Right.
That's pretty. Thank you.
My name is Fran Hardy, and I'm the Director of Operations for Missoula Developmental Service Corporation. And we are here at the table looking at building what we're going to call an activity and enrichment center for adults with developmental disabilities, with more of a focus on those who have intensive needs. Everybody here, or not here, but in Missoula seems to know Opportunity Resources, Inc. Well, we're the second, we're like the best secret of Missoula. We currently serve 70 individuals residentially and in day services. And we've been here since 1990. We have over 200 employees. And most people go, we didn't even know you existed. But we have purchased a piece of property. Where we're housed now is a very old building, very warehouse-like, which is not the image we want when we try to help our individuals. And so we're just coming to the table today, starting in the planning process. So we're probably looking more for funding for, like I said, some of the technical assistance and the planning. Overall, we anticipate the project to be about $4 million. We currently serve 70 individuals, but there are more and more individuals, what we call aging out of services, out of children's services. And so we are trying to meet those needs for the future. So that's it.
All right, great, good job. All right.
Is there anybody else from public?
There's one more, yeah, absolutely, Free Cycles, but I'll speak really quickly for Mountain Line. So Mountain Line has a bus stop master plan that is in place, and something that we don't really think about a lot is that what we need funded are things like bus signs. We need curb and gutter. We need accessibility to bus stops, and where it makes sense, we need shelters and varying levels of shelters. Just a little transportation funding nuance here. We don't get local funding for any of our shelters, bus signs, those kinds of things. And as you know, Mountain Line passed a levy, and there has been conversation with the ability to potentially support the bus stop master plan implementation locally versus using those levy dollars. So those levy dollars are really around the operation and expansion of the bus systems themselves, not necessarily the infrastructure. So literally making sure that the curbs are painted appropriately so people don't park at bus stops, things like that. So the overall project is $1 million. It can certainly be phased in, and the concentration for community development block grant funds would be in low and moderate neighborhoods. So it is shovel ready and ready to rock and roll.
And I'll use my outdoor voice just to say that we have used CDBG to make transit stops accessible.
Fantastic.
So occasionally there's places where you can't get to the stop very well, and that is an accessible or an allowable expense.
Excellent.
Yeah.
Thanks, Nancy.
Yeah.
So did you say
We just have one more.
expansion, you're going to include more route times?
No, I did not say that.
Okay. Visceral hearing.
Come on up.
Hi all, my name is Emily Jensen and I'm the Programs Director for Free Cycles and Missoula Institute of Sustainable Transportation, or MIST is less of a mouthful. Right now we're in the midst of a capital campaign called Cycles of Change, which is essentially to purchase the property where we've been renting for the past 11 years. So this is the 20th anniversary of our organization, and as we see it as a really good opportunity to kind of solidify our current programs and provide more social bicycling services to the rest of the community. So we're going for it. We're along with, do you guys know about Free Cycles? Should I explain a little bit? Okay. Well, yeah, along with that, we want to continue our work under MIST, and so do a lot of advocacy work and infrastructure work with the city to essentially advocate for more sustainable designs that are more equitable for all, including streets and trails and whatnot. So, yeah, thank you.
Anybody else from public facilities? Okay. Economic development.
No, you're
Oh.
All right. So our little group,
about development in the Bonner area, the Milltown area, specifically because for like developing more business, and at first you need more infrastructure. So we talked specifically about housing and sewer, which sounds like it might be coming up soon. We also talked a little bit about getting more employment experiences, specifically for youth with disabilities as they're transitioning out of high school and into the workforce, and figuring out ways to work with employers to facilitate those internships and work experiences. We talked about the internet and getting better access to internet for businesses, as well as subsidizing some for lower income families. What else did I miss, group?
Any projects?
We did not really talk about projects. That's okay.
We have one.
We have one? Oh, okay.
This is Bruce's.
Oh.
I'm handing yours in.
Okay.
Your vision.
Oh, I have to read it. Do you want me to read? Small multifamily housing for, there's no infrastructure, in 2016. All right.
Not really here looking for grants or money, we're just primarily looking for ideas and needs.
Perfect.
And we find that there's a need for either relaxed sanitation requirements in areas that don't have sewer or an ability to get some sanitation there.
Yeah.
And we're finding out that the EPA actually prefers on-site treatment as opposed to going into the collection system and then hoping it gets to a treatment plant 10 miles away.
Yeah. Well, thank you for your
And
report. Oh, go ahead.
without infrastructure, there's no development.
Yeah.
And down there in Bonner, West Riverside, there's been no affordable housing or stick-built housing built in the last 40 years.
Yeah. Yeah, I agree.
Great. Well, thanks everyone for your feedback. Let's see. So just in conclusion, if you are interested in applying for home or CDBG funds, we are having our application workshop tomorrow morning at the grants office. You are welcome to attend. It's not a requirement to apply for home or CDBG funds, but we can talk you through the application process. But if you have any questions, feel free to contact me or Cindy. Our business cards are on the back. Our information is also on our website. What's the next slide? So thank you for coming. We really appreciate your input. I'm always love coming to these types of meetings and hearing what's going on. And it's just, I mean, this is just one of the reasons why Missoula is great, that there are people working on this and that care about this. So, do you want to add anything?
Well, just, we have about 10 minutes. Way to go, everybody, being on task and utilizing the agenda to the last minute. So, like we said earlier, we will be putting the presentation with all of the data up on our website. So the URL is here, missoulacounty.us/grants. And also, we just wanted to give you guys an opportunity to ask any questions if you have any, because we have a few minutes left. Was there something else you wanted to say?
So then,
Go ahead, Jim.
the county has a plan, the city has a plan, or is it a joint plan depending on funding? Because I know the city it operates its own CDBG in the home, so
What a
then
great
outside
segue.
we
Set
have
that
to. Want to get that vodka tonic?
We
that you-
get to get a Snickers.
Did she like tell you guys to test us? Is that what's going on? So there are separate plans, but the CDBG home funds that we're talking about that are available are predominantly city funds. So there's state level funds that can be used in the county. Is that right?
Patty, go ahead.
Is there anything happening with jail diversion that may come forward?
No. Well, we have, yeah, so the city and county are working on a jail diversion master plan, and I'm guessing that will be released in the next month or two, and we're gonna be applying for House Bill 33 funds, which is a state fund for crisis mental health jail diversion, for folks that don't know. And at this point, I don't know that anybody's applying, though, for jail diversion from federal funds. although there are some DOJ grants out there as well that we can always look at. If you have filled out project sheets, make sure to either leave them at the table back there or give them to us. And then Nancy just wanted me to mention that the next step in this is that we will compile all of this information, and it will be part of our action plan that gets submitted to HUD in May. Yeah, so, and Jean will be working on that. So thank you all for coming. We really appreciate it. Thanks.
Please be sure to sign the sign-in sheet if you have it yet.
Don't forget to sign the sign-up sheet.
Yeah, be sure to sign in if you didn't already before you leave. Thank you. You bet.